Good morning, everyone, and thank you for being here. As you all know, the cities and the county and UMC, we've been working hard together to make sure that we continue to work off of one list and continue to have the registration for vaccination efforts as one. It's been an incredible improvement, as you've seen over the months and days and weeks, that we've been able to efficiently register our citizens. And we had a list of over 300,000 people on this list at one time. And we're here today to tell you that we've gone through that list. We have actually gone through the list of 300,000 people that had registered for the coronavirus. So, for the vaccination. So it's really important that now we have our registration. You can go on and register today. And when you go on the register, you can actually make your appointment at the same time. So we're asking all the adults that are eligible for the vaccine to go to epcovidvaccine.com or dial 212-6843. And that's important because now, instead of going into a registration portal, you will be able to register and set a time for your vaccination. So that's really exciting news that we've been able to work through the 300,000 that we had registered. I'll give you some numbers that have been on the dashboard, and we've been very proud of the dashboard that we were able to come up with. And if you want to go to the dashboard, it's epstrong.org. But here are some of the numbers. Our population 16 and over, and now that we're vaccinated 16 and over, we have always used that number. We weren't at 18 and over. So when you talk about the herd immunity and the number of when we talk about the percentage of population, we've always used 16 and over. So 16 and over for at least one dose is at 58.6%. That's a big number. And fully vaccinated, we're roughly at 37%. So you know that in the coming weeks, we're going to have a vaccination rate of 58.6%, because now we're going to be given the second vaccine. But that'll grow. That'll continue to grow. And we're trying to reach that number of 75% herd immunity. And herd immunity is what we're reaching for, where people feel comfortable in our community. Our hospitalization rate today is at 7.72. That's when we started talking about opening up our businesses. When we talked about the governor had said you don't have to use your mask any longer, we're at 15%, and we have lowered, because of the great community. The great city of El Paso has given us the opportunity to still wear the mask, still social distance, still do the right thing. So we're at 7.72%, which is incredible. Our super seniors, and this is something that a number that I know the county judge and I are very proud of, and the city and everyone's proud of, that our seniors 65 and over are at 84.26% of our seniors have gotten the first dose, and 67.28% of our seniors have been fully vaccinated. So that tells you that our seniors 65 and over are almost reaching that part of the population as at herd immunity. And that was very important. We listened to our community. If you remember, we needed to make sure that we reached out and went out and reached out. And I know that the county went out and did the outskirts of the city. So we were able, if you look at it, 67% of our seniors have already had their full vaccination, and that's 65 and older. So we're very proud of that number, and we'll continue to do that. Now, we're moving our senior vaccination site to the Northeast. And when we've moved it from area to area, starting this Monday, we're going to go to the Northeast. We do see a spike in people coming in and getting vaccinated. So we're going to the Northeast starting Monday the 26th. Again, I want to, we heard the community. We took the community feedback, and we've been able to reach the numbers that are probably one of the best in the county, in the country. I know one of the best in the state. Our locations will be the Convention Center, our city clinics, which is Stanton, Rincon, and Alameda. And the new location, starting Monday again, will be the Northeast, beginning with Joey Barraza and Vino Memorial Park. And then we're going to do an appointment-free vaccination this Monday at the East Side Sports Complex. So anyone that wants to go get a vaccine, anyone that's ready for a vaccine, it'll be an appointment-free at the sports complex. And we're going to continue to reach. We all know that the number we want and the number we're achieving for is 75% herd immunity. We're right around the corner now, and this is great news that we were able to go through the 300,000 names. But if for some reason your name, you feel you're still on there, the news has even gotten better. You can just go on there, register, and make an appointment all at the same time. But again, I really urge our community to continue to wear face masks, continue to wash your hands, continue to have the 6-foot distancing. You see the great numbers of today. We were in the 80s in positive, and we'll continue to make sure that we vaccinate our community, because I know the judge and I will tell you that we will not rest, we will not continue to better this program until we stop losing lives in our community. And about exactly 30 days ago, I did an interview with the Rockefeller Foundation, and in the Rockefeller Foundation, the doctor from the CDC said that within 30 days that we would have to change the way we do the vaccination process. And I can tell you, it's 30 days and 1 day since I was in that in the Rockefeller Foundation discussion, and we've been prepared, and we're preparing. We're getting prepared for the next step of how we continue to do it. The city has been preparing for the last 30 days. I know we've been working great with the county and our partners, UMC. And our next step will be to work with companies and organizations to be able to work with them to give the vaccinations and continue to give vaccinations to large groups and groups out there. So this is something that we've been working for, and we were prepared for because of the great work by the city of El Paso and the county. And with that, I'm going to turn it over to our great partner, the county, Judge Samaniego.
Thank you, Mayor, and what a pleasure to be here. We're in such a better place today. You know, the demand is reducing. We have the better supply, but very excited about that situation. But just want to let you know it's part of a trend in the entire United States. We expected it, maybe not this quick, but we expected that would be the issue. Now, we do need to understand a little bit better, you know, how do we reach out? It's now going to get to a point where we're going to be able to reach out, try to get as many groups that we can. For example, this Saturday or tomorrow, we'll be at Grace Garden. We'll try to vaccinate all the seniors that are going to have graduations and the seniors that are going into proms. And so we are targeting, because we're now being extremely proactive. You know, we know that if we think about what might happen, for example, if we have seniors going in, then we might be able to get them. So we're hoping that we do get a lot of our seniors throughout the high schools, or anyone that thinks they're going to get in a congregation situation. But one of the things, we have to become more innovative. We have to be better at trying to figure out why is it that we're not getting as many at this point in time. If there's hesitancy, we're going to do a lot of educational. The mayor and I are really going to try to get people to make the decision based on evidence. We know there's a lot of things out there. We do know that people are not going into hospitals or going into a severe situation if they have the COVID shot. So that in itself is extremely promising for all of us. So that innovative approach is going to be so important as we move forward. We have groups, for example, things are coming up, and you're going to be hearing about things that are coming back to normal. But I can guarantee you that the mayor and I are not going to allow things to come back to normal abruptly or at random or not done in a proper manner. For example, juries. Juries are coming up. We're already working with all the federal judges, with all our judges and staff that are going to be part of the jury have now gotten vaccinated. We're also looking at our jurors. When you receive a summons, it'll say, if you haven't been vaccinated, this is a phone number that you could use to get vaccinated. So as you can see that it's going to be really important as a community. And I want to thank the community because, you know, when we have a slowdown in numbers, you might not understand the impact that it has on the healthcare workers. And as we're able to provide vaccines and get that shot in the arm simply because we have health workers available. If it shifted, if we had gone into some kind of a spike, now you're going to shift that personnel focusing on COVID. And And so we're very, very concerned about, keep making sure the numbers, the masks are being worn. I mean, I can't tell you how proud the mayor and I, when we have people from out of town telling us that's not what's happening in our community, but it's happening here, and we get congratulated for the mask wearing, the social distance. Some businesses still at 75% until they're ready. So once again, we're not out of the woods, but it helps us tremendously to keep wearing your mask. And then what we're going to do, we're reaching out to UTEP. UTEP is doing a sample and sort of focus group to find out, what is it that we're doing that we need to do better. If it's hesitancy, let's educate our public. If it's not accommodating, when do we need to do it? When we're going to extend the hours at UMC and other locations to be open later at night, earlier in the morning, because we want to make sure that it's not based on lack of accommodating our constituents. And so if we're not accommodating, I'll tell you, the mayor and I are going to figure out what we need to do to accommodate everyone that we can. And so we're looking at that possibility. If you have any information, or you could tell us, why you feel, or what do we need to do as a county, as a city, if you could call 915-546-2098 and give us your feedback. I mean, I think one of the things that the mayor and I have shown is that transparency and that willingness to help, but we cannot help if we don't understand what the challenges are out there. So once again, thank you to our community. Keep wearing your mask. Help us get that vaccination out. Help us to be a role model to the entire country. Thank you.
Now, one of the things also the number that I want to share with you all today is that dose administered, which is first and second dose by the city of El Paso, is 590,597 vaccines. So that's a huge number. And right now we're at 100% efficiency, and we want to stay at 100% efficiency. So we'll continue to do press conference and update to make sure that our community is aware of the things that are available. And we appreciate our partners, which is the media partners that get the word out to the public that, how we're going to start opening up, how we're going to start rolling out the next step that we've been working on for the last 30 days to continue to be efficient. One thing we did commit to the state of Texas was that if you give us the vaccines, we'll put them in arms. And right now we're very efficient at 100%, and we want to continue to do that so we can continue to get the vaccines to vaccinate our community. So these are big numbers in our community, and by having a press conference, we'll continue on a bi-weekly or as needed to make sure that we communicate with the public. And I thank again the media for being here to help us get that message across. And with that, we'll open it up.
Hi, good morning. My first question is, I guess, do you guys know you just reached out to the community asking for feedback, but is there any idea of what it's keeping people from getting vaccinated right now? I mean, we're getting closer to our community, but of course there are these people who are still hesitant. So I guess from the city and the county's perspective,
I think real quickly, I think part of it, we have different reasons to believe that we've gotten to the people that we're going to do everything possible to get them. And now we're getting to people that might want more convenience to getting that. J&J also impacted a little bit to say, what's going on and should we wait for J&J? Some people were really interested in J&J. They like the one-shot deal and leave. And so there's a couple of things, but there's nothing negative. It's just a community trying to understand what's better, and the mayor and I trying to look at locations and places that are going to be more convenient. So I think those are the two that are the most important.
Well, one of the things the CDC said back 30 days ago, that as an elected official and a community leader, we have to find different ways to continue to vaccinate our community. There's people that are on the fence whether they want to get it or not. There's people that are not quite sure that will ever get it. So it's our job to make sure that we provide the opportunity and we continue to go out there and provide this for our citizens. So that was really important that when the CDC issued that report that within the next 30 days, we prepared for it. And this is our next step today. You have a question, Rick?
¿Qué tal? Buenos días. Les quería preguntar por qué la decisión de cambiar el centro de vacunación para seniors ahora al Northeast.
Lo que me preguntó es lo que estamos haciendo, comenzamos aquí en el West Side por el Don Haskins y nos movimos al Lower Valley y el Pavo Real y ahorita vamos a cambiar al Northeast y continuamos a cambiar de partes de la ciudad para vacunar a todos los senior citizens. Pero la cosa es, cada vez que lo cambiamos, vimos que sube el número y es lo que estamos viendo, que moverlo para darle la oportunidad a todos, pero la oportunidad que es más... ellos pueden nomás salir de su casa, está ahí por la vuelta. Y es la cosa que vamos a continuar a hacer. Ahorita lo que vamos a hacer es hacer eso, pero también todas las personas de 16 para arriba, vamos a ver cómo podemos ayudar para esos que hagan la vacuna.
Thank you for time for questions. First question I have two. With the more than 300,000 people that have registered and have received a vaccination, about how many people are still on the registration list now?
I'm sorry, how many people are what?
About how many are on the registration list now?
You know, the registration, we had 300,000 people waiting in registration. The county and UMC and us have gone through and made appointments for the 300,000, and we've exhausted that list. If you were on the list and for some reason did not get a call, the good news is you can go today and register and make an appointment all at the same time. So we worked really hard to make sure that we built that list. The thing about the list of 300,000, it wasn't actually 300,000 people. It was 300 registrations, and people double registered, triple registered, and registered in multiple areas. So when we were calling, and I know that the county was calling, and when they'd already been vaccinated, they had already made an appointment somewhere else. Because we have a lot of great partners. We have partners like Walmart, Walgreens, CVS, private medical providers, and UMC. So we have a lot of medical providers, and everybody wanted to make sure they got on every list. So once they got on every list, they started duplicating lists, or they weren't sure if they got on the list and they would register again. So we've gone through that list, and that's what I'm saying. If for some reason you did not get a call, which I'm hoping everyone did, the great news is you can go on and register and make an appointment all at once.
And for my second question, about how many shots have been received to be at the point where people can be able to make appointment times, like not having to wait, but be able to actually register and have that definite appointment time?
Go ahead.
Well, actually, that's now. The portal at UMC opened last night at 6 o'clock, and we still have plenty of opportunities, so anybody that calls can get an appointment at that particular time. So UMC is one of many that we're available to at that, you call, we get an appointment, and we get that shot in the arm.
Yeah, that day is today. And, the important part is if we all look back and we think about when we started and we had our first case of COVID-19 a year ago, none of us ever thought we'd have a vaccine ready to be administered. No less, we're talking 13 months later, and you can call and get an appointment today, and that we're at 58% of the public has already received one vaccine, and we've received 590,000 vaccines. So it's we never thought we'd be here today. So it's really the great news, and our federal government has really worked hard to make sure our citizens, not only in El Paso but in the U.S., continue to get vaccinated.
Now that the registration list with the city has been, gone through, and UMC opened their own registration last night, will the city and UMC still be working together with the registration list, or vaccine registrations will have to be separate?
Well, that's the key. We're able to now know who has them, who's got more opportunities, and we work with each other. I mean, the mayor might say that they might need more and we need less, and so we're at the point where this great partnership, we can shift to see who needs it the best. And the most important thing is that we find out. And the only warning I can give you is that I want people to really take advantage of this opportunity, because remember that the state will allocate depending on your demand. And what I don't want is the hesitation to happen. They slowed down on the vaccine, and then now we're going to have to go get vaccine because we got more people. So it could be like a vicious cycle. So if we get people now and we get that traction going, the state will continue to provide it. So just really help, the community needs to help us in the next 2 to 3 weeks to make sure that as a vaccine comes in, we're able to put it in the arm, and then we could move forward accordingly.
You know, our continuous improvement and partnership with the county will continue to just get stronger. And that's how we're where we're at today, and we'll continue to work together. This is just the beginning of the way we'll continue to work as one, and it's worked out incredibly great, not only for us, but our community.
Para el juez, mencionaba que poco a poco le vamos a regresar a la normalidad. ¿Cuáles son las modificaciones que vamos a ver en las próximas fechas en el juzgado? Mencionaba que depende de la corte.
Pues en las cortes ya estamos preparados, tenemos ya varios meses trabajando con todos los jueces. Ya tenemos, comenzando en mayo, ya estamos pidiendo, vamos a tener la primera audiencia del jurado para comenzar ese proceso. Una cosa muy importante es que la confianza de las personas que les llamen, porque no queremos que si muy pocas personas llegan, es más difícil escoger el jurado. Pero ya estamos preparándonos para todo lo que es la corte, y así como se abren, obviamente, los departamentos anexos, ¿verdad? También se tienen que abrir para darle el apoyo. Tenemos un plan que, igual que la ciudad, un plan que sabemos qué tantas personas pueden regresar, en qué momento, dependiendo en las actividades. Lo que sí le vamos a decir es que muchas cosas quedaron así como nos gustan, como vamos a continuar a hacer las cosas por visual y continuamos. Muchas cosas van a quedar en su lugar para nosotros poder continuar con la normalidad, pero hacerlo de una manera muy racional y con mucho cuidado, que nos vamos a regresar a una situación difícil.
So we talked about how you guys exhausted that list of 300,000. Was there a point, or is it fairly steady in terms, or are you guys noticing registration for vaccines going down?
You know, the reason why we were able to do it, because the county and the city were working together to work off of the same list, which is something we talked about. And again, like I said a minute ago, is a lot of people were registered multiple times, either in our site or in other sites. So as we continued to go through it, we were able to go through it rather rapidly because they'd already gotten the vaccine from the county. You saw the county was going out to the outskirts. The city was opening up mega sites, whether it was a convention center, the George Perry, and then the private medical providers that were able to give their patients the vaccination, and then Walgreens, CVS, Walmart, Sam's. I mean, all these people really helped us go through our list, and then we're working off of our list. But they gave these citizens that vaccination, which helped us go through the list. Now, you know, that's why I'm asking people that for some reason, if you didn't get a call from the county or the city, it's going to be just go on, log on, and register, and you'll be able to register and make an appointment all at once and be prepared to get your vaccination.
The first one is, you mentioned about the Johnson & Johnson actually causing people not to go to them because they wanted to get that shot. So is there any hesitancy that you're seeing, you know, after it was paused, any shots, or what would you say are the other factors?
Well, it was a touch. I mean, obviously, everything that happens in the media and what, you know, there's a reaction to it. And so there was people that were considered, but when they heard that it was 6 cases out of 7 million, people begin to reassess that. But like I said, we got almost the opposite reaction. People saying that they're waiting for J&J more so than I'm not going to take the. But people liked it. It's a really convenient situation. When we have 2,000 people not on J&J, we get those 2,000 people back in the logistics and all that, and they have to wait for a couple of hours. J&J obviously seems to be the vaccine of choice.
We're coming up on a month of all adults in Texas being eligible to register and receive the vaccine. Are you concerned at all that perhaps the reason we've gone through the list is that other adults in El Paso are interested in getting the vaccine?
No, I think you've seen that, you know, that the people went and registered for the vaccine, but we still have, and that's why we needed to prepare, and that's why we started 30 days ago, because the CDC said this would be the next step. So we're going to the next step of making sure that our community gets vaccinated. So you know, we will go out and reach out to different areas, and we will reach out to businesses and continue to go to make sure that we reach that herd immunity. And that's the important part. The number that we'll continue to reach for and strive for is 75%. And as you see, we're at 58.6 first dose. And, you know, so you're looking at within weeks that we'll be administering the second dose to a lot of these people.
Pues algún mensaje para la comunidad que aún está, pues no sabe si ponerse la vacuna, por lo que usted comentaba, lo que ocurrió con la vacuna de Johnson Johnson, algún mensaje para aquellos que aún están indecisos.
Lo más importante es ver los datos y qué es real y qué no es real. Lo que sabemos es que no ha habido ninguna persona después de recibir la vacuna, sea la primera o la segunda, que llegue al hospital, que llegue severo, que tenga que estar atendido, ir a un ventilador y obviamente que muriera. No, se ha bajado muchísimo, obviamente no, hemos visto muertes relacionadas en estos momentos, entonces yo pienso que tienen que pensar, ok, sí creo que hay un riesgo en la vacuna, pero hay más riesgo en que le dé COVID. Entonces el mensaje es de que pues tienen que tener confianza. Una cosa que le estamos pidiendo, que si les falta confianza, la mejor persona, como ustedes saben, que tenemos mucha confianza, es con un médico. Entonces, estamos pidiéndole también a los médicos que pregunten, ¿ha recibido la vacuna? Si no la ha recibido, ¿por qué no la ha recibido? Y luego tener una plática con el médico. Estamos usando todo lo posible para hacer educativo. Pero el mensaje es que vamos en muy buen camino. Van a haber muchas situaciones donde nos van a pedir que estén vacunados para viajar, o a lo mejor va a haber conciertos, va a haber muchas situaciones donde sí les conviene tener la vacuna porque tienen el derecho de pedir que sí o no han recibido la vacuna. Un negocio privado tiene esos derechos. Entonces yo veo que es algo muy importante que la comunidad pueda responder rápido en este momento y tomar esa decisión.
Chihuahua is about to go back into red with public cases and the hospitalizations. How is this going to impact El Paso, and how is it also going to impact the citizens of Rio and San Central? And are there any plans to share vaccinations with, Juarez or specific plans in that?
Well, we know the binational approach. I can tell you that the mayor and I are very interested because it's very rational that if Juarez isn't taking care of their situation, it's difficult for us to take care of ours, and vice versa. They're great neighbors. We want to help each other, and we know that we're on the same boat here. But I think that one of the things that helps us, if we could get to that herd immunity, then we have more of an opportunity to share. And then I can be able to be more explicit about, hey, we need your help. I'll give you an example. We've got the refugees, we've got the inmates, and that it would be very difficult, as much as people want inmates to be vaccinated, very difficult for a community to say, I have my 90-year-old grandmother doesn't have a vaccine yet, and you're giving it to an inmate. So I know that as a community, which is a phenomenon because we want to take care of ourselves, that's why I want the community to expedite, let's get the vaccination going, and then that allows us once again to be that generous community to help others. But we can't help others if we don't get ourselves, as the mayor said, to a herd immunity situation. In other words, we won't be in a position to do what we need to do as a community.
I think you saw that a couple of weeks ago, we had Secretary Mayorkas and we had Chairman Thompson to El Paso because they do know that border situations are different than the rest of the country. And being in Washington and not really seeing it for yourself was important, but not only coming to the border city, but dealing and meeting with the local leaders was very important because we've seen a lot of people come to the border and they have press conference and they leave, but they came to talk to us and see how they could make sure they work with us to make sure that our border city continues to be a safe city. And that was very important.
I have a couple of questions. So I guess the first one, you did mention that J&J was the vaccine of choice, Judge. If, the CDC and the FDA say, all right, we're going to allow people to re-administer J&J, once that decision is made, is that something that you guys are going to move forward on quickly and start administering? And then the second question that I had is, you mentioned also that you're moving the clinics to vaccinate more people in the Northeast now, the seniors in the Northeast. population that we're still focusing on getting vaccinated, or is there a specific population that you want to focus on? You also mentioned.
Well, first of all, we never move quickly because once we get that information, the mayor and I still work with public health, make sure that we understand why. There's some speculation that they might go out next week, but with certain limitations, and then we obviously will let the public know if there's limitations to the J&J to certain target people. And then secondly, we're going to reach out to the community to see if they feel safe and they feel comfortable with that, and if not, we'll continue to do more education. But I can guarantee you we won't move quickly. It's just because they say yes. One of the things that the mayor and I have done is there's a lot of uniqueness in our situation. We had 2,500 people. We reached that mark this week, and that was a little higher than most counties. So we need to understand why those things are happening. So whenever we see something, we have to apply it to the community to see why it's impacting. And the mayor can answer the second question on that.
You know, and it's really important that we reach every segment of our community. And this is just another step of us reaching every segment of the community. You know, like I said, we need to make sure that we continue to go from Northeast, Mission Valley, downtown, West El Paso. We need to make sure we equally reach out every part of the community, and that's our next step of doing that. And that's why we're moving in that direction. One number that I do want to share with you, that we're still testing 30,000 people for COVID every week. And the amazing thing is that today we had positive was only in the 80s. So that's attributes to wearing the face mask, social distancing, and washing our hands. But also the most important part that we're attributing this to is people being vaccinated. And we'll continue to have the COVID test available. But this is a huge number to see that we're testing that many every week, and the positives have gone down very dramatically. So we're very happy to report these type of numbers. And with that, I want to thank everybody for being here. And like I said, the most important part of our job is to make sure that we have these numbers and provide these numbers, but you, the media, helps us provide this to our community, and we thank you for doing that. Thank you. May God bless everyone, and have a great weekend.
Thank you as well. Thank you.